you have kind of this process that goes on in your brain, and regardless of whether you want it to or not. And so you're entirely right. There are several, there's a group of people that are in denial. They're still in denial. I'm as shocked as you are, Dr. Dart. Denial is a shocking process when people are still just in that place of complete denial that it is even a real thing. They are still in fight, flight, or freeze mode. Those are probably people that have experienced some trauma or chronic stress in their lives, and they just can't embrace it and process through it, so they defy it. With the mask, it's kind of the same process as well. There's some denial there, but there's also, I think, some other processes going on. So with the way that our brains work, we know that we have emotions and we know that we take actions, but we don't realize that we have very immediate thoughts right before our emotions. And those thoughts are rooted in what our belief system is. And so depending on what our belief system is dependent on what our emotional reaction is going to, our automatic thought and emotional reaction are going to be, and thus our actions. And so he's right in the sense that we do need people to have a certain level of buy-in, especially at corporate levels, because if we have corporations at large disagreeing and not cooperating, then we kind of have this upheaval of the system, the city system, right? I think we as individuals tend to think, well, just be a few people that won't follow and then we can deal with that. And that would be hopeful, and that's, I think, what Dr. Dart is saying, why we have to get the corporations online as well, so that we're all coming together as large entities saying, this is what's best for all of us, join us in this effort. And then that will only leave those handful of people that don't want to follow wearing the mask. Also, one of the hugest things is that people they want normalcy. I mean, there is an instinctive drive inside of us for normalcy. So they are going to fight against anything that's not deemed toward them or in their mind, in their perspective as normal. They're going to fight that, and they're going to fight for normal. I mean, think of it as if you're in your home and someone suddenly comes in your home, and they're not breaking in, but they're bringing a band with them and they're partying it up and they're coming through your house with a party. Well, you're going to be like, whoa, time out, you're cool, but get out of my house, right? It's the same kind of concept. It's this, whoa, you are in my space. This is my world. I have control over this. I want normalcy, and I'm going to do normalcy. So those are kind of the factors at play. And then you do have some mental health factors where people literally, they have anxiety disorders, obsessive compulsive, generalized anxiety, those kinds of things that can really exacerbate and make it difficult to use a mask. However, some people have been really clever with some different ways of doing that and overcoming. So I think, again, even on those scenarios, when we can find that common ground together and take it forward. I mean, we might have to mandate it in order for it to come forward. It's kind of this chicken or the egg. Do we have to mandate it to get the corporations and the education system and et cetera online? Or can we get them online and then mandate it for the general population? Mm-hmm. We work a lot in the education system. These are many conversations we're having. Mental health professionals and educators are very overwhelmed. I spoke in Oklahoma City today with the mental health director for the Oklahoma City Public School Mental Health Program. And they did a survey, and 81% of the teachers are fearful to go back to school because of the risk of COVID. That's 81%. That's a lot. That's a vast majority, and rightfully so. And then on top of the risk of COVID, we also have racial tensions that can play out in schools, as well as other conflict that could occur between parenting and different expectations about mask wearing at the schools. So when you start playing all the scenarios out, we could have an upheaval in that process too if we don't have some direct leadership somewhere. And so I think, finding which to do, the chicken or the egg first, and making sure we move forward is a good approach.
Yeah, thank you. Well, and I think, part of why I decided to have this meeting tonight is that it, for myself and my colleagues on the council, we've hit some real solid blocks of realization of where our powers lie and do not lie as city legislators, and what we can and cannot do. And there are places where I am not going to be able to legislate something, certainly not on my own, and I don't want to and can't do things without the mayor, but there are things that the community can do separate from what I can do, but I can help coordinate the community, and I can bring the community together with experts like you two to help figure this out. And I'm hearing you say, like you said, the chicken or the egg. I guess that's what this meeting is, for everyone to know that we are coming at it on both fronts. There are city councilors in Tulsa and commissioners at the county level who absolutely want to do all that we can do. And at the same time, we're going to have to get all of these business leaders and community leaders and the public on it. We have to come at it at both fronts at once. We can't do just one or the other. We've got a bunch of great questions from you all. And let's see, I'll just start at the beginning and we'll see what we can get through here. Dr. Dart, there were some questions about clinical therapies, plasma. Robert Brecha was asking, what do we have? I've seen a lot that day. What is the state of COVID-19? What is the state of our hospitalization rate and our therapies here in Tulsa and our testing here in Tulsa? Just a quick update on that, if you could. Oh, I think you're still muted, sir. Let me see if I can fix that. All right.
How's that?
Perfect. There we go.
So we expanded testing quite some time ago, and in Tulsa County, we've been working very closely with the healthcare system. They've been testing all of their members, private providers. We've been testing pretty much everyone else in the community who wants and needs to test. So I think right now our capacity to test is not really the issue it was. Of course, early on, we do have. Before it was getting the materials to collect samples and then actually do the laboratory tests, and that's gone much better. So our pods are filled up every day. But there's been some movement on therapies that really haven't found anything that so far under rigorous scientific examination has shown to be like the number one therapy for this. We know that people who have been positive and produce antibodies, when they get plasma, that's been shown to do a really nice job for those people on ventilators who have been really sick, but that's not really the therapy of treating the masses. So it's good for individuals, but it's not going to help everyone. And so until we get a vaccine, which, I think there'll be some concern when the vaccine does come because it was produced so quickly. Normally when vaccines come, they go through a pretty rigorous clinical trial process that we just flat aren't going to have time here. And I think the fact that it will not go under the rigor that normal vaccines go under could be a hesitancy factor for some people to take the vaccine. You might recall for H1N1 10 years ago, that same issue existed and that vaccine actually worked quite well. So I'm hoping that the scientists continue to do the great things they've always been doing. But and that's why like these conversations are so important. That's why hearing from all of you are so important, because we've got to listen to the community as well. And and we're not afraid of politics or fighting any battles. That's what we do. We just want the right thing to happen for all the community, and whatever that is. And if the entire community says, hey, we need to mandate, then we'll go mandate. We'll do what we have to do. But no matter what we do, we still have to get people on board as to the why and what COVID is, and that fact is not going away. And as Rebecca mentioned, their normal is going to be completely different, and we have to get people comfortable with that and to embrace that, I think. And that's why no matter what, we need to communicate and campaign and never stop and really always speak to that awareness issue, and because we've got to get people on board and come together. You have huge tragedy events like you know, 9/11, and everyone came together. And, we're almost in a situation where we're fighting this huge enemy. It might be invisible, but it's a huge enemy. We've got to get people to come together and fight it unilaterally, as opposed to all these different perspectives that are impeding progress, and just are ultimately contributing to the chain of transmission. So, if this is what the community wants, Councilor, we will do whatever the community wants us to do. And that's not a problem. I mean, it's we just want to do the foundational things as well. So, and as I said earlier on, if the data is telling us that don't wait, mandate tomorrow, we'll mandate tomorrow. We'll continue to follow the data. In the meantime, those things that we have to do to bring the community together, to get acceptance about this is the proper actions, we have to do that no matter what.
Right. And in this time where so many people have shifted from traditional media to utilizing social media, while we can, hope we get the CARES funding to help promote a campaign, in the meantime, all of us can continuously share everything that's posted on the health department, Facebook and Twitter and whatnot. I try to do that all of the time, and you all can push that stuff out there, as well as at Nextdoor and other places. There's also some really great videos from Vox and some other places that explain exactly, how all of these things are working. And I know that when one of the hard things about this is this feeling of helplessness. And let me tell you, as a counselor, I feel it every day right now, both personally and, really wanting to help all and protect all of you. But every time I get some more information, education out there to people, I think that makes a difference. And I hope that you feel that too. But I think you're absolutely right, Dr. Dart, that we have to convince people. And one of the things that I have seen that helps convince people is seeing that their friends are on board. And so I'm, while I think having a campaign out there can be good, as I mentioned to you earlier, I think I'd like for us to go ahead of whatever we manage to come up with the chamber, and start collecting the information that we have about what organizations, what businesses are already requiring masks, so that we can get to the point of sharing the information. These are the places we know are utilizing the best practices. Once we have a good handle on some of that information, to already have that gathered, and that's something that everyone could help us do. And did you get to talk to your staff about that? Is that like a Google spreadsheet I should make, or is that something that you all want to originate?
So I did put in a call to the chamber, because I was one of the chamber had their own list of all their members, and I'm waiting to hear back from them. So I haven't talked to my staff about it yet. They knew that was part of our conversation, but we haven't talked about the how to yet, because if the chamber is already keeping track of that, that'd be an easy first step.
It would, and let me know about that. And
okay.
And then I feel like we could do something like, whether we take out a big ad in the Tulsa World or whatnot with lists of people who are going to do it, or we all change our profile picture to like, I'm a protector. That's not what we should call it, but something, that says I'm somebody who's going to completely comply with CDC recommendations and go a step further to let our communities know that this isn't about politics. This is about saving lives and protecting each other. Because as I see, looking at the comments and questions on here, we've just got a lot of people worried, and a lot of things going wrong. There are folks out there. Chelsea Kester mentions, I spoke to my event vendors. I'm an event planner, and many of them were telling me they had 2 to 4 each day this past weekend, and only staff wore masks. None of the attendees are wearing masks. And so, those kinds of things that we know are happening right now, I feel confident that we're still going to be having this surge. And so it's going to take everybody in government and everybody in the public. And just so you all know, I think Dr. Dart said it, but I'm saying it as well. We have not given up on the idea that we may need to mandate masks. It's just the next council meeting is on July 15th. I can't do anything until then. The mayor was going to have a press conference today and talk some more about, I think, what Dr. Dart is telling us now. But as you all know, the 2 police officers were shot. that kind of slowed us down on that. But let me look for some other questions here. More people encouraging us, for Tulsa to take the lead. Feeling embarrassed. Education. We've got a lot of people who don't believe in science in Oklahoma. It's a really hard thing. Limiting the capacity in gatherings is a really good idea. And I think that, as Texas has come forward with they've shut down bars and some other things this week, I feel like it or not, that's going to make it easier for some folks in Oklahoma, some leaders in Oklahoma, maybe even at the state level, to take those steps. I'm having a little bit of trouble with my mouse. What funding resources are available to residents if they end up in a hospital? That just disappeared while I was reading it, with COVID, and are left with excessive bills. Well, that may get decided tomorrow in the ballot box. We've got the state question deciding about the Medicaid expansion finally, and at the city level, for those who don't know, the state of Oklahoma is the only state in the nation that requires municipalities to be dependent on sales tax. It's part of why we are always struggling for funding and trying to figure these things out. It's part of why we have these really difficult battles with our neighboring communities for sales tax dollars and for businesses. And while the business argument is the first argument to make in any sort of public health emergency, these are people's livelihoods, and like you say, people have to pay their healthcare bills. Figuring out how we're going to do that is really tough. Marissa, if you could help me look through the questions too. I keep seeing this just kind of jump around. Yeah.
We had a question for Ms. Hubbard. How do we battle the never-ending conspiracy theories?
We need to just keep telling the truth and being consistent and staying on message. Because as much pushback as I get, I don't react to it. I just respond, and we can't stop telling people. I mean, we don't tell people what they want to hear. We tell them the truth, and it's really difficult when I think when Councilor McKee mentioned that education is a factor here, and we have to make sure that we communicate in a manner that everyone can understand, and there's no confusion. And that's why I said it's important that communication experts help us fashion this campaign, because as I said, in public health, we dictate way too much. We have to communicate and we have to connect. And that's, I think, our next challenge.
Yeah.
Yeah. And,
I would agree.
Oh, yeah, go ahead.
Yeah,
Rebecca, please.
I would agree. Communication and education are key. And ultimately, just choosing your path. You can lead a horse to water, but you can't make them drink. And just like people are resistant to certain thoughts and they act out, conspiracy theories can be part of that as well. And you're not going to be able to force anybody to think differently until they're ready to think differently. One thing that you can do that's relatively benign, but might on kind of an undercurrent kind of way make an influence, is just, with people that you're close to that think it's a conspiracy, just say, well, even if it might be, I'd rather take the risk of not harming someone than take the risk of harming them.
Yeah, that's a really good way to come at it. I think it's really easy for us to get caught up arguing with the most vehement conspiracy theorist voices out there, but bringing that focus back to the people who are closest to you, who
Councilor McKee, we lost your audio.
back, that really makes a difference. Another thing is when someone says something to me that I disagree with, instead of telling them that they're wrong right off, sometimes I ask them questions to help them kind of feel heard. Like, tell me more about where you heard that. Why do you think that is the case? I hadn't heard that before, because I found that people are much more willing to hear my perspective if they know I'm hearing them. We're all having to debate, and that's I think something that we see in society at large for a while now, figuring these things out. Marissa, were you raising your hand? And Dr. Dart, did you have something to say? I wasn't sure if I, no, okay. Marissa, what were you gonna say?
Oh, we lost your audio for a minute.
Oh, okay.
That's what I was pointing to.
Yeah, okay. Well, I have no idea what I was saying.
It was all really good though.
It was so on point. I was profound, y'all. You don't even know. I think I was just saying that, you know, it can be helpful to focus on the people that aren't wildly out there, but the ones that can hear us and can just be a little bit safer. And then the other thing was to ask questions if someone disagrees with you, instead of just coming out with "you're wrong, that's stupid," saying, "I hadn't heard that before. Why do you believe that? Where did you get that information? Can you tell me some more about that?" So that they feel heard, because I found that when people know you're listening, they're more likely to listen to you. At least that's my strategy for debating people on the internet, and it seems to work a whole lot better than some other strategies I see out there. Marissa, what are some other questions that we have out here?
We had, in addition to the reported 120 COVID beds at OSU, how many COVID beds are available in Tulsa County, and how many cases can Tulsa County hospitals handle and maintain ordinary operations?
So the hospitals prefer that we not release numbers, but every bed in the healthcare system is potentially a COVID bed in every hospital. We know we have the special floor at OSU with about 120 beds, but every bed that is in the healthcare system is a potential COVID bed. I can tell you that the ICUs in every hospital are not filled up, which is a positive thing, but we are starting to see more COVID patients in the med surge, and that's, I think that's important to know. We have about, today, we have, well, actually, it was the 27th, there were 68 people hospitalized for COVID in Tulsa County. I think it's 68, somewhere in the 60s. So, and that number changes, people are released and admitted. So, you know, but I think it's some of the messaging around, oh, you know, it's okay because our healthcare system right now can handle a surge. Why? That's not the position I want to see our healthcare systems to be in. I don't want them to say, you know, we've done all these restrictions, so we keep ICU bed open for you. I mean, that's not the way I want to approach this. I want the hospital systems focused on the ability to serve all the healthcare needs, not just COVID. And that's a place where, that's why we have to collectively come together around what precautions are so that we can keep people from being exposed and being infected and being hospitalized from that. So long answer, I'm sorry.
That's useful, and I agree completely about that messaging being a problem, because I especially as we've seen that there can be some really long-term health issues with COVID, even if you recover. I see a question from Skip. What solid evidence is there that cloth masks prevent infection of others? Is it accepted as fact that it does not protect the wearer?
You know, and a lot of that, I think part of our problem with masks is that early on, you know, we were not telling everyone to wear masks. We were just telling people who were sick. And now the data's been pretty clear that it does. Wearing a mask can protect you from being exposed. If you're masked and you've got a person with COVID in front of you coughing and hacking, a two-ply cloth mask can filter out about 79% of those viral particles. So there is some science that's showing us that it does protect both the uninfected and infected people, and it does prevent transmission at that rate. Now, what you're wearing, of course, really matters. I mean, if you're wearing an N95 that's been fitted, it's 95 because it filters out 95% of those particles. So cloth masks are better than nothing. Two-ply, as I say, can filter up to 79%. So the science is pretty clear that masks, yes, they protect other people, but they also protect you. Mm-hmm. And I think that's where, before it is always like, just wear a mask to protect other people. Well, it's protecting you as well. So that's part of the dialogue too, that we've got to get on that horse and ride it.
Right. And also, I sit in on the OSU COVID updates as much as I can on Monday, Wednesday, Friday mornings. My husband's a physician as well. And so I sit in on those to inform MHAOK and his clinic. And they talk, you know, Dr. Clark consistently says the mask also protects you because when you're wearing it, you're not touching your face, your nose, your mouth, your eyes, and thereby it helps you to not transmit it to yourself as well. So I think that's, you know, I agree. Every time I watch Dr. Clark's, I'm thinking, why can we not just put her on a commercial? Like every Monday, Wednesday, Friday morning, she has her spiel that she does about 6 foot of distance, you know, 6 feet of distance, masking, don't go out unless you have to, wash your hands frequently. You know, she has her points and it's just spot on. And that's what we need everybody to really buy into. And then we're not going to overload our hospitals. We're going to be at a manageable level. I'm with Dr. Dart. We don't want to push the limits of what we can do at the hospital. We want to preserve life and care for everyone, whether that's COVID illnesses or other illnesses or in health, and to stay healthy.
Yeah, absolutely. I know people who have needed to go to the hospital or a doctor's appointment who didn't have COVID, but who didn't make it there. And at least one friend that died because she needed help and she didn't go get it. We've got to get past this together. I see a question from Aaron Griffith asking when the city of Tulsa will engage in COVID-19 municipal wastewater testing. Will we do this? And if so, when? Dr. Dart, is what all have you all looked into with regard to testing the wastewater to see percentages of infection?
We haven't explored that avenue yet. It's something that we're talking about over the long term to, as this response progresses, to really figure out the penetration in the community. But right now we're so focused on the response. That's not an activity that we've engaged in yet. That's an activity that we probably will down the road. And I have talked to the water department a little bit about that, but it's not something that we've really had the bandwidth to engage in just yet.
Sure. Yeah. So many things that we planned to do that we were all hopeful and excited about this year got sidelined in every department in Tulsa, I think. And every life in Tulsa, I can say. I'm going back through to see questions, points that I have missed. Ochadi mentioned bringing financial pressure on businesses. You know, I by patronizing those who practice the good social distancing and mask wearing and sanitization and all of that. And we talked a little bit about that earlier. I personally get the impression that our reopening of the economy will go a lot better when we get more compliance with all of these things, because there are a lot of people who would be buying things and shopping right now who just aren't going out. And so I think we do need to bring that pressure. Dr. Dart's been talking to the Chamber of Commerce. I'm going to do that too. Dr. Dart, we briefly talked earlier about the possibility of, if we as individuals make our own little videos, our own PSAs, our own like, hey, I'm wearing a mask, won't you, kind of things. Is there a way that the health department can help us make sure we've got the facts straight as we put those out there? I don't know what would be the best way to do that. Should I collect them and check them? Or do you want us to just,
you could collect those in a central platform that we could actually go in and review. We'd be happy to do that. And one thing I really love from people, just to see the creativity in masks. I mean, so there's a lot of ingenuity and creativity out there. I would love to see expressed that way from both educational and just a conversational component. So if you could figure out how to collect those comments, sometimes central platform, we would be happy to go in and review them. And frankly, probably some good ideas we could steal, so.
Right. Yeah. I've been looking through Austin, Nashville, Portland, Minneapolis, other places that are doing campaigns today, just trying to get an idea of what's already out there. Let's not reinvent the wheel. The update you heard that you said we get every Monday at OSU, Rebecca, get a good mic and some lights on her next week and send us, the roughest sketch that you can get, but getting it out as soon as possible. I think that's really what we've got to do. Marissa, did you see other questions that I have missed?
Yes. One from Joan Craver. Moving forward, I would love to have clear messaging about the various masks available and their effectiveness. and about the care and feeding of masks. I see folks with masks around their necks, only covering their mouths, etc. How often do you wash them, disinfect them, things like that?
And we do have some of that on our website now, and depending on what decisions we make, we'll definitely dig into that deeper and provide, I think, more detailed information for people how to care for their mask and how to clean and disinfect masks. So it's you know, we've talked about a little bit. I've had individually a lot of conversation with people about that thing, and you're right. We need to make that available to everyone.
If you all don't already have the Tulsa Health Department pinned in your dashboard, or linked on your desktop, or somewhere easy to find, just put it in the chat. I check every day at 11 o'clock. There's updates on the numbers, and there's always good information. I know I see your team's putting new stuff out there all the time, Dr. Dart, and I also have changed my following settings on Facebook so that I see your posts first, so that they're always coming up, so that I can like, comment, and share them. If you don't know, when you comment on something, it changes the algorithm on Facebook, and it makes it more likely that people will see it. So adding those comments, even if it's something you already know, can be something that each one of us can do to help spread that information. Marissa, what else do we have?
Sorry, my dog is barking in the background.
Oh, it's all right. My baby is crying in the other room.
So.
Aaron Griffith asked, have you reviewed the Mayor's Economic Advisory Committee's report on reopening? If so, do you support the recommendations under the current circumstances? I think
Under the current circumstances, yes. So, but the thing about this we have to remember is that the circumstances change so rapidly here. And when the group was together and I was part of that group, I was very clear about whatever recommendations we do come up with, they have to be flexible because the environment might dictate change. And I suspect that will happen in this case as well.
Yeah. And that goes for me as well, Aaron, if you wanted my opinion, that I think it's a good plan. I have spoken to the mayor about representation on that committee, having the committee be more transparent and ongoing, and better representation from and to the council with that we didn't have as much communication about that as I would have preferred. But there's a lot of scrambling going on right now to get everything done. But it seems like they've really covered a lot of bases with that plan. And if you see any issues in the plan, as usual, let me know. But from what I see in the conversations I've had with Kyan Camus on the mayor's team, it looks like we're doing a pretty good job of covering everything. What other, let's see here. So are we going to talk about how to connect with friends and loved ones at visits while minimizing risk? That's a great conversation to have. As I've been looking through this, so one thing I'll let you all know, I made a tough decision and decided I'm going to go work at the polls tomorrow. If it protects even one Tulsan who is over 65 or who has, some other vulnerability. I'm young, I'm healthy, and I am so serious about social distancing. I might even have some big foam poles that come out from my shoulders to show people how to stay far away. And I have my mask, and I'm going to change masks all day, and I'm going to wash my hands and arms all day. And I've got one of those plastic face shields to come down as well. So don't worry about me, but I'm going to be out there tomorrow. And so I've been reading up a lot. And, one of the things that we found is that being outside, transmission outside is a whole lot different than indoors. So if you're going to be with friends, the things that we're looking at is you want to be outside, you want to stay distant, you don't want to share food. I mean, if you're going to have a gathering and you absolutely have to have food, prepackaged, have like picnic style, here's a little picnic for every individual. You can also have people rotating in and out. So like 5 people show up 1 hour and then another 5 people another hour. If you absolutely have to have a gathering. I was reading something about a mom who felt like they had to have a graduation event. You can space things out, that physical distance, the airflow moving outdoors when you get that good airflow, facial coverings, Those are some things, Rebecca and Bruce, are there other things that you all want to add in there?
No, you covered it really well, Counselor, and there is a big
I am
difference.
a nerd.
You got it. You got it down, and which is awesome because it's. I think people they only hear one message, and we've talked a lot about indoor, but outdoor is so much safer. It just is, and the data has been really cleared. And if because we need to be connected, and staying away from family and friends really isn't an option. We did it for what, 2 months, and it's hard for any human being. So let's reimagine those connectedness, but just follow Councilor McKee's recommendations about how you do it, because we're not saying don't do it, we're saying do it safely, and what the Councilor just lined out was perfect. So
yeah, for Father's Day we had a picnic at the park at Woodward Park, and each household had its own blanket that was several feet away from the other blanket. And, I was all masked up when it was time to cut anything that we were sharing and distribute to the blankets. But then we, go to our own blanket to have our face uncovered briefly.
mm-hmm.
We've done similar things, and I completely agree. It's very important to stay connected to your loved ones, because this is definitely a mental health challenge as well. And our natural desire and innate way that we're made is to have connection with our loved ones and, friends and family. And I work at an amazing place and we all miss each other. So even our coworkers, we really, really all miss each other. But if we're going to see each other, we do it very safely. My parents are over 80, and so we're extreme. My husband's a physician, so he's exposed potentially every single day. So we're very careful when we see them. It is always outside. We are always about 10 feet apart, and we don't share any touch surfaces at all. And I think it is important to understand too, though, that is still not normal, and that can still have a mental health impact on you. And so even during that time or after, you may feel a little bit down, and just acknowledging that is different than your normal, and that it's normal now to not feel great about it. You know what I mean? To be a little sad, but then to move on. And if you're able to move on from there, then you're okay. If you get down and you're really struggling, you continue to struggle, then that's a different story. But some ebbs and flows in your emotional well-being is going to be very normal at this time, especially as you connect and disconnect and enter lots of different, unusually new normals for yourself.
Mm-hmm. Yeah, absolutely. And that's another thing, social media wise, to be sharing the resources from Mental Health Association Oklahoma. We have more telehealth options than we used to, and it really is important that nobody suffer in silence. I've heard from numerous mental health care professionals that if there's a silver lining here, it's that COVID has helped people be a little bit more okay with not being okay, and for all of us to admit that our mental health is suffering, and that we're all suffering together, and we need to reach out to each other. I don't remember the exact numbers, but Mike Gross, when he talked to council last week, was talking about suicides versus homicides, and there's always a lot more suicides per year.
Three times.
Yeah.
3 times the amount of suicides to homicides.
Yeah, and I know you all do that excellent training with what is it called again?
It's QPR. It's with the QPR Institute. It's QPR training: question, persuade, refer. And yes, we can do those online now for any group, and we've had quite a number of requests and are doing those. I'm doing one tomorrow morning, first thing. And we also put our support groups online, which is another silver lining, and added many, many support groups, especially stress management related to COVID and other specific needs. So there's definitely been unfortunately, but definitely some, and also fortunately at the same time, mental health awareness and embracing of talking about and recognizing that mental health is, a normal part of our life, just like our physical well-being, financial well-being, etc.
Mm-hmm. Mm-hmm. Absolutely.
We also have,
the
mental health, and I noticed that you posted it on your page, so thank you so much. The Mental Health Assistance Center is available, and individuals can call that and get assistance, because the mental health system is rather difficult to navigate. at times. And so our mental health assistance coordinator is phenomenal. She's very knowledgeable about all of the resources available in our area. That number is, I'll put it in the chat. It's 918-585-1213, but I'll put that and the pages to link to our support groups in the chat.
Fantastic. Fantastic. I saw a question about the K95 masks not protecting people. And I are those the masks that have the little vent on them that let air out? Dr. Dart, do you know anything about those certain kinds of masks that protect the wearer but not the people around them because they let out too much vapor?
So they've had with the KN95s, the vast majority of those are foreign made. So they've had, it's not so much the filter, the mask that N95s are fitted to you so that there's no exchange. With the K95, the KN95s don't fit as well. So you're not fully, so the 95 means you're protected for 95%. Well, with the KN95s, that doesn't happen because the fit isn't as good.
Good to know.
Yeah, we stay away from KN95s if we can here.
Let's see, Marissa, but can you hand us another question?
Any thoughts on why the 18 to 35 age group has the highest percentage of new cases? Are we seeing an increase in deaths and hospitalizations in this age group as well?
We're definitely seeing an increase in hospitalizations in this age group. 23% of our hospitalizations over last week were in that age group, which is not even anything we were seeing 2 months ago. So what we think is that they're the demographic that's going out and really resuming their life the way it was pre-COVID, going to bars, going to parties, doing all the social things that people in that age group do, but they're doing it without wearing masks, they're doing it without social distancing, and not paying as close attention to hygiene and hand washing. So they're putting themselves in positions to be exposed and infected much easier than the demographics who are paying attention to masks and social distancing. So matter of fact, we're getting a meeting set up. Brian Kurtz from the Tulsa Downtown Association has set up a meeting with all the downtown bar owners so we can have this conversation about how do we keep people safe in these facilities that are really conduits for transmission.
Absolutely. Caitlin Seagrave added a link to a Twitter thread that is helpful about empathetic messaging and compassionate messaging around COVID, and that is in the chat. And it is we did talk a little bit about messaging and about how to get the information out there and how to share messaging. I think some of that is going to have to happen as far as like, we discussed the possibility of us making our own videos to remind people that to wear masks, to social distance, to wash your hands. That's something that you absolutely can do. And Marissa and I can talk tomorrow morning, or probably Wednesday morning, since tomorrow's election day, about where we could gather those things and have the health department help us vet our videos and make sure that they are absolutely accurate, if that's something that people would want, as we push those things, that information out there. And I'm going to keep collecting that, as well as Dr. Dart and I, to reiterate from earlier, we're going to be working with the Chamber of Commerce on figuring out how to get a good list going of businesses that are requiring masks, requiring social distancing, and to have a way that you all can help add to that list, whether it's a Google form or some other format that can help you connect us with the folks that are doing that, as well as a campaign of letting people know that we as individuals are going to be, doing our very best to protect each other in this. Jim suggests a public shame list. I have been reminded by several of my colleagues on council that we do have a diversity of reasons that people might choose to do or not do things. And certainly I have business owner friends who have told me they don't feel safe requiring masks because their business is running on such a thin margin and their competitors aren't requiring masks. It comes back to that overarching need to have something from the policy level to protect all of these businesses. Yeah. Marissa,
Yes.
what have we got?
We had another question. How do we reach people who don't get their news on social media or the internet? Are there mailers or anything like that that are being sent out?
We're not, because we don't know where to send those to, but I think that's why a public campaign, because it'd be over all the mediums, not just the social mediums. So it'd be radio, TV, those kind of things, because not everybody's on social media. And we have to make sure that we reach everyone and use every tool that we've got at our disposal to actually do that.
Mm-hmm. Absolutely. Yeah, and for those who missed the earlier part of the meeting, we're hopeful that the CARES Act funding that's come to the county will help us be able to pay for a larger informational campaign. It seems likely that that's something we can use that funding for. And Dr. Dart, did you say you're talking to county commissioners about that tomorrow? Is that right?
Yes.
That's fantastic. Yeah, I see some folks complimenting the Starlight Lounge for making the tough decision to voluntarily close. I'm seeing that from some others as well. But yeah, that was one bar that I saw that from. I also saw Flo's Burger Diner has been feeding people. I love seeing the ways that people are coming out and helping each other. If you see anything like that, make sure you send it my way so that I can push out that good news. Again, with regard to our mental health, we need to know the ways that other people are helping, both for our own mental health and to give us ideas about ways that we can step it up and help each other more. There's a lot of need right now, and I think I was talking with our fire chief earlier today, and he said, just like with Hurricane Katrina, it was even a decade later still finding out ways that people were affected, still accounting for all of the things that have shifted. And so we're very much in the middle of this historical moment where it's even a bigger deal than I think even we can see.
The trauma from this down the road is really going to tax our mental health system more. I mean, people have been extremely traumatized before this, and now ever since February, it's off the charts. So we've talked about long-term plan to respond to mental and emotional health issues after this, and that's not my area of expertise, it's Rebecca's, but we know it's a need that is going to come.
Most definitely. Yeah. And I think that it's important to understand that when people are in the midst of a trauma, they're functioning in their midbrain where their emotion control center is. They're not always thinking completely logically. They don't have that cognitive processing going on as fully often. So when you maybe have a tendency to get frustrated with someone, understand that maybe that's just kind of where they're at right now. And they maybe need a little more patience and support to embrace the truth. Trauma is an odd kind of process in the brain. And the fact that many people, the thing that really concerns me, Dr. Dart, is that many people are still kind of functioning as though they are still in that trauma space months in. And what kind of long-term impact is that making on their mental health and wellness? So we are all definitely very aware of the potential impact, a likely impact that this is having. And I know even also the reopening and all the dynamics related to the reopening is also, I know that myself and others have young adult children who are having to decide whether to go back to work or not, or to move back in with mom and dad, or what to do, with their own risk and what's safe and what's not. And it's a strange world to be 18, 19, 20 years old and be worried about getting, an illness like this. And then also having all the social dynamics going on as well and the emotional mental health processes. So I think we need to be mindful of kids and young adults and kids and the way that they're processing things as well, and helping them to kind of process through these and think about what they're feeling and what they're thinking and what they're experiencing, and then finding that meaning that helps them about the context of what does this mean to me, and finding a meaning that helps them feel a little more in control and a little more able to make decisions for themselves, but yet stay safe and also express. And, you know, a lot of mental health is being aware that you have it. You know, we all have mental health, whether we want to admit it or not, we have it. And we are on a continuum on any given day. And is we can be aware of that and we can acknowledge it, then we can address it. And then if we're unable to address it on our own through activities such as, you know, meditation, yoga, exercise, eating well, all the things that I'm sure Mike recommended last week at the council meeting, if we're unable to really get a hold of it, then we can reach out for help at that mental health assistance center that I gave, or one of the local agencies.
Absolutely. Yeah. And it's going to be interesting to see how kids get through this. I was talking to a friend the other day who had her 3-year-old son ask her when he can stop running away from the other little kid when they're out on the playground. And it just broke my heart. It's so hard. It's so hard, but when they're at least old enough to hear and to understand, if you've got little kids in your life, PBS, OETA are doing some really great PSAs from cartoon characters talking about being at home, social distancing and whatnot, and you know, finding those resources and sharing them. We all really need to be doing that and helping each other with that.
Definitely.
Yeah. Marissa, what else do we have?
Yeah, there was a question about testing results and if there's a backlog. It was answered by Dr. Ruffing that at the moment he is getting tests back in 48 hours. The lab is beginning to get overwhelmed again, however. So the more tests that come in, the longer that the wait will be. Dr. Dart, if you want to expand on that, go ahead.
No, Doc was absolutely right. They've been pretty consistent in reporting 24, 48 hours. We actually just met today about, we're getting many more calls now about people wanting tests. So and I talked to healthcare systems, they are as well. So we've called the lab and say, you're about to get a glut. And so let's ramp up capacity and we'll see if they're able to do that.
Thank you for that, Dr. Dart. We had a question about why are restaurants not required to disclose to the public when employees have tested positive?
You know, there's HIPAA rules that we all have to follow and pay attention, and we can't release protected health information. And what you need to know though is that for every positive, all the positives in Tulsa County are reported to us. We contact that patient. We do contact tracing. And any risk of potential exposure from that individual, we contact other individuals or businesses or other institutions that they might have been. So if you haven't heard from us, then you're not a part of that exposure. And I think our staff have been doing, and I'm biased of course, but I think our staff have been doing a really good job of contact tracing and identifying risk. I mean, for every case, we average 36 contacts per case. So we've really been drilling down. So if you haven't heard from us, you have not been in that situation where you've been exposed. We can't, you know, we can't even release to the restaurant, for example, that a worker's been positive. A worker can tell them, but we can't. So we try to walk that fine line of protecting the public and protecting health information as well.
Dr. Dart, do you have a way that, say someone worked several shifts while they were positive, is there a way that, and they were in contact with someone's food or utensils or anything like that, is there a way that you can trace the people that would have been at that establishment if you're not able to talk to the restaurant? Is there?
What we've been doing is putting out notices that, for example, if you ate at this restaurant on this date and this time, please contact the health department or your doctor because of a potential COVID exposure. So if we have to announce it publicly like that, we have, or for a very specific restaurant, there's a lot of people that you know, everyone pays by card. So we have ticket information, and we're able to identify some contacts that way, but it's hard because it's just a name and not contact information. So if we have to do public disclosures, we can find the individuals, we find them as well. And so far, you know, it's people are very mindful, I think, at least working in the food and drink industry, and they know that the risk that they're posing. So we've had, I think, great conversations, and people have been really good about getting to us information so that we can get it to those who might be at risk and get them either tested or at least a visit to their doc.
Is that something that we can help with, that you need our help with? If there's, if you need to get that information out to the public, if you were at this location, then, you know, you need to be aware. Is that something like, where do you all put that information out if you have to?
You know, if we have to use the our media platforms, we do. For example, we use the news, whether it be radio or TV. We'll put it on our digital platforms as well. If we can share city digital platforms, that'd be great as well. We haven't had a situation where we've had to do that mass notification just yet, but we know that more than likely it's coming. So we're prepared to go if we have to.
Mm-hmm.
When Medicaid expansion passes tomorrow, how do you see it impacting our local COVID response capabilities?
You know, I think Councilor talked on it earlier about some people aren't seeking medical care, you know, for a variety of reasons, from fear to not having insurance. And, you know, it'd be really nice to have everybody covered so that that's not a barrier to seeking treatment, seeking care, or seeking testing. So our testing, we don't charge, it's free. And we say that very much, quite a bit. I don't know how many people know that, but you know, when people are covered, then they seek care, and access isn't an issue, and that's going to hopefully remove that access barrier that we've had for a long time in Oklahoma.
Mm-hmm.
What is the current effectiveness of the COVID test available? Antibody testing versus the nasal swab, etc.
You know, the labs we actually use 3 labs. We use RML, which is Regional Medical Laboratory, or 4, we've got the State Public Health Lab, OSU, and then we have a side lab in Kansas City called Vicor. So if there is an overflow to our labs here, we can send specimens to Kansas City, and they've all been verified for reliability, sensitivity, and specificity. So the nasopharyngeal is pretty specific and pretty sensitive. Antibody tests yet, we're not really confident that they've gone through the rigor of verification that the nasopharyngeal tests have. So there's still some question about false negatives and false positives with the antibody test. We're hoping that, you know, and it was part of that's because that test was rushed through the process so quickly, and so over time we expect that to change and have the same reliability that we have with nasopharyngeal. We're just not there yet with antibody testing.
Mm-hmm. Kelly Jennings asks if we could put flyers in the water bill or the electric bill going forward. Kelly, that's a great idea. And it's something that I've brought up with the city about several issues over the last year. And one of the things that I've learned is it's just really expensive to add things to. Even one piece of paper, just mail is expensive. That's not to say we won't do it. It's absolutely on the table, and it's something I'll talk to my colleagues about. It can be difficult to get that going, but this is a difficult situation. So I think we really need to look at that. And that might be the kind of thing that, again, CARES funding might be able to help pay for. Mm-hmm. Oh, David mentioned that the Medicaid expansion won't take effect until July 2021. Thank you for that reminder, David Blatt. That is sad.
I was hoping not to go there, David.
Right? I know. Very difficult. Yeah. Marissa, what else have we got?
Let's see. We had a question a while back. This was in reference to the Mayor's Economic Recovery Committee. It was asked if local tribes had any say in that. And I looked up the list of all of the people who were included in that committee, and I don't recognize any of those as being tribe leaders, local tribe leaders. So I'm not sure about that.
Dr. Dart, can you speak to that? Have you all been working with Muskogee Creek, Osage, Cherokee Nation, and any others that are nearby?
We have been here at the health department. We've helped each other out quite a bit. We shared information, and also have shared some contact tracing of patients who belong to different tribes. So we've been pretty active with the tribes. I don't think that you're right, Marissa. I don't think there are any tribes part of the mayor's committee, but for our department, we've been very closely connected with tribes here, especially Cherokee and Muskogee.
Mm-hmm. I was asked by Jim about the way the city can and should step in to level the playing field, with the idea of a public shaming list, but is there a way that we can do that and take the economics out of the situation? Jim, I'm right there with you that I want to do everything that we're supposed to based on the health data and not on any other factor. I was mentioning that in the context of, as an elected leader, having to be aware that there are these other things that are coming into play in the discussions as my colleagues and I are making these decisions about the long term. And that's a factor that's there. I do feel confident that the health department is advising us based on just the health facts. But I'm absolutely there with you that I want to completely level the playing field and put in all the precautions in place that we are able to put in as soon as we're able to put them in. Yeah, go ahead. Mm-hmm.
Another question, this is for Dr. Dart. Are you familiar with OMRF antibody testing to boost COVID-19 research? And if so, can you comment on the part specific to studying Native Americans?
Yeah, I'm really not. So I think that's a question that I can't answer, but we can do some research here and get an answer for your constituent counselor.
Mm-hmm. Mm-hmm. Thank you. I want to go ahead and end at 7:30 as people are starting to wander out, and we've covered a lot. And I also want to make this video available to those who missed it. I did actually forget to hit record, and so that first very important section with Dr. Dart and I is missing, but there's still a lot of useful information that folks can get from this. Are there any final questions, anything that I missed, anyone that has a question we have not heard from? I want to make sure that we cover as much as we can. Dr. Ruffing mentioned that there are many, many studies underway, and that is absolutely the case. It's the whole world is right now trying to figure this out, and I'm so very grateful to not only all of the medical professionals on the front of mental and physical health, but everyone in the sciences trying to help us figure this out, as well as all of our emergency responders. While we're getting our final questions in there, I do want to say that, be kind to everyone by not setting anything on fire this weekend. We really, really are down about 100 firefighters already because of COVID. Please ask your neighbors to be safe. Remind everyone there are ways to celebrate the 4th of July that don't involve ending up having to call the fire department. And so if there's a way you can encourage that, please do. Yeah, what else do we have on here? Chelsea asks, when we have questions for our business related to COVID, how can we get them answered? Who should we contact?
Is that for me?
I think it's for all of us, and you can always email dist4@tulsacouncil.org because Marissa and I will hunt that stuff down. Marissa, is that what you were going to say?
Yeah, that's what I was
going
to I point to Marissa, so.
Right?
Yeah, you can always email Councilor McKee at dist4@tulsacouncil.org or me at Marissa Gomez at tulsacouncil.org. We're pretty good about getting those answered as quickly as possible, and Dr. Dart and his team are really, really amazing. Anytime we have any sort of question that is related to COVID-19, he and his team usually have an answer for us. So you can send those to me and I will get them answered for you.
And I just saw that Dr. Ruffing just posted that for anyone who's sick, please call your doctor first before you go in. Thank you very much for that note, Dr. Ruffin. That's so critical. And then they can implement infection control protocol before you walk in the door. So great point.
Absolutely. Yeah, that's very important. It looks like we had a few questions that aren't related to this topic. I do want to answer those. If you all would email those to me to help me focus those conversations and get all of the information that is needed. And yes, Erin, we do need to have just an open town hall to discuss any issues that everyone wants to bring up. You know, we had that great town hall to try to focus our conversation and get some top priorities. And then, you know, 2020 just went all over the place. And so I think we need to refocus and get some more information. I want to get that open for you all. If not in July, then in August. But that may be what we focus on in July. I don't want to make any promises right now because the situation is fluid and I've got to be able to go with what's going on right now. Are there other questions I missed, Marissa?
No, I think we've answered just about all of them. Oh, wait. Jim asked, okay, no, wait, 2 months then.
2 months.
Yeah.
The answer, no. I will answer other questions long before that. I'm just saying, I don't know if I'm going to be able to have a town hall that is open for open discussion on any topic. But that might be what we do in July. If that's what folks want, please let me know that. If that's what you're saying right now, Jim, I think it would be a good idea for me to put out a survey and ask folks what they're wanting to talk about. Because like I said, I had a good idea of what we should talk about based on conversations that I'd been having. And then I shifted this past week just because of what was going on in the moment. And so I really want us to talk about what matters to you all. Erin asks if I'm too busy campaigning. No, that's not actually what's going on. Although it is frustrating to have a campaign season in the middle of all of this. Let's see here.
You know, I do want to say real quick to all of your constituents, Councilors, that Councilor McKee's been in front of this, on top of this since day one. I really appreciate your support and your willingness to step up and be part of all the solutions to this multifaceted problem, and you've been great. So thank you so much. I haven't had a chance to tell you thank you through all of this, and I appreciate everything you've done to protect your community and your constituents and the city of Tulsa as well.
Thanks, Dr. Dart. I'm trying. It's hard, but
I'm
really glad I get to work with you and with Rebecca Hubbard and Mental Health Association and everyone on this call. Even those of you that I don't always agree with, that you push me, that I push you, that we figure this out together. It's really important. Dr. Dart, Ms. Hubbard, are there other things that you want to remind people of before we wrap up today? Any final thoughts?
You know, I appreciate all the input. I mean, the more people get involved, and please stay involved. I think we gather this input to make the right decision, and without your input, we won't get to the right place. So please continue to do that, continue to communicate. My email address, my door is always open. We need to do this, respond to this collectively. So let's continue to stay together. And even if we agree to disagree, we're at least talking about it, and that's more important than back into a corner doing nothing. So.
Absolutely.
And I would echo that just from a mental health perspective, and continue to connect with your loved ones and be kind to one another, and make sure you're taking care of your own mental health and well-being. Yeah.
Absolutely. Absolutely. Thank you all. Be safe. If you've got more ideas, more questions, more comments, send them my way. We will keep doing our very best, and we're in this together. I appreciate you all being here tonight. Take care. Be safe. Have a good holiday.
Thank you.
Thanks, everyone.
You too.